All right, good health, and welcome to today's edition of Doc and Dean. Each week, we're going to be with you to bring you some discussions on some of the latest issues in the news, especially as they relate to the African American community. This is the year end. Obviously, this is probably a very good time for us to reflect and go back and see what some of the stories were that made headlines and what the ramifications are. Ramifications, that's a pretty good word for me.
That's a big word. That's a big word.
What the implications are for you and your family and our communities. So welcome, Mr. Dean. Are you celebrating in the New Year's this evening?
Oh, we'll be celebrating, but celebrating from home. I'm not planning to go out anywhere. Just me and my family here.
Yeah, I don't think there's anywhere to go out in the Bay Area. I think we're all shut down in terms of New Year's Eve festivities. Well, one of the things that people may not appreciate about the last year on blackdoctor.org and other areas of the media is your involvement in the discussion on the coronavirus epidemic from stem to stern, from day one to the present. Probably, I would say, and I'm not the world's expert, but I'm not bad, that you're probably the most knowledgeable person that we could talk to about this pandemic in terms of your experience in interviewing a number of people across the spectrum on almost every aspect of this pandemic. Let me start by asking you, what does it look, go back to what it looks like and looked like a year ago and compare to what it looks like now?
I think, honestly, that really hasn't been much change from a year ago now to then. And I think a year ago, we were in the middle of, trying to get, because a year ago, we didn't even have the vaccines. I got to think about it. I was 20,
Yeah, they were just getting started vaccinating.
They were just getting started. And so it was just, they were just people in nursing homes and people that were over 65, they were eligible to get vaccinated. There were surges, there were people still, it was still a lot of confusion. And I think that's what's happening right now still again with the emergence of the Omicron variant, is that there's a lot of confusion. The CDC has been kind of, the guidelines have been moving and changing, and we can talk about that. And I was trying to help somebody on social media kind of understand that. And I think I did a pretty good job, because they told me I did a good job in terms of helping them understand how and why the CDC is making the decisions that they're making.
Before we get to where we are in terms of the guidelines, were you surprised at the confusion that we've been experiencing at this late in the game around not only vaccinations, but also about the age ranges and the protocols? What surprised you most about how we roll this out?
Well, first of all, I'm not surprised by the confusion, right? It's that old, game that you used to play in grade school, where you start with one story and you whisper it around the room, and the story had changed by the time you got to the end of the chain. And that's the way communication works. And so I think people hear bits and pieces, and they take that piece and they add their own kind of wants and desires to it, and then that's the information that they share. And so when you have, in today's climate, when you've got multiple social media platforms, multiple agendas, and just kind of, and the way this whole situation started under the past presidency with a lot of confusion about it, I'm not surprised at where we are today. I do think that people need to be a little bit more practical. If I could, if I could be judgmental just for a moment, I think people need to be a bit more practical and be a bit more cautious, and stop trying to max out what they can do and be conservative with regards to their behaviors no matter what the CDC is saying.
Well, were you surprised at the politicization of this whole vaccine thing when it first started? I thought we were all in this together, that we would all kind of come together and around vaccines, but very quickly this became a political issue. Whereas manhood is defined by not wearing a mask instead of throwing your body over a grenade. Now it's like if I don't wear a mask, it makes me a man, and a whole number of dynamics like that. Did that surprise you?
No, because I mean, the past presidency was all about getting credit for things even that he did or he didn't do, and about trying to denigrate the other side. And so we created a climate in the country where everything became, we're good and you all are bad. No matter what side of the aisle or what side of the spectrum that you were on, it became all the good things that are happening is because we did it, and all the bad things happen is because y'all won't let us do anything good. And so the vaccines being caught up and being fueled by government, it added that same thing. At one point he was saying it was a warp speed and I'm going to bring these vaccines. And when they didn't happen before the election, it became suddenly a bad thing. And so I'm not surprised by that. What I'm hopeful is that people really realize this is a public health issue and not a political issue. This is about keeping you and your family safe. And even though you might survive, this is about how you feel about your neighbor, because your neighbor might not survive if they catch this virus. And so when you're wearing a mask, when you're washing your hands, when you're staying out of public spaces, you're not doing it for yourself. You're doing it for your neighbor. And I'm really saddened by the fact that people don't grasp that concept more.
I think one of the dangerous things is a lot of the advice that people are getting about not getting the vaccine are from vaccinated people. They get vaccinated. They don't tell you they get vaccinated. Then they go right back out with the same philosophy. Talk to us a little bit about the hesitancy issue, where it's been, where it is now, and where it's going.
Well, if I was encouraged by one thing, I think the hesitancy issue has waned a little bit. In the fact that when we did some surveying at the beginning of the pandemic at Black Doctor, there was about 70% of our audience that said they were not getting vaccinated. Fast forward 18 months later, when we surveyed again, 70% of the people that responded said that they were vaccinated. So I do think there are some kind of, I won't say full disinformation or misinformation, but I think you have to look beyond the stories. Now, Black Americans are still running below our average with regards to being vaccinated, but you have to look at where most Black people live. They live, highly concentrated in the southeastern quarter of the country, and that area, Black or white, is the lowest vaccinated. And so we can't say it's more of a Black thing. It's just kind of more of a Southern conservative evangelical thing that has been happening, and Black Americans are caught up in that.
I would venture to say that blackdoctor.org has probably done more to educate the African American community than just about any other media outlet. I mean, they stopped, how it is when it first started, they were talking health equity, you had a lot of Black doctors on TV. You have to look a long way now to find a Black doctor as an expert. But I would say that if people have wanted to follow this with accurate information, blackdoctor.org was the number one source for that on the media. Now, let's talk a little bit about children. I think that, now, and we're going to get to, when we finish our discussion, what the recommendations actually are right now. But let's talk about the issues around vaccinating children. I think we have a video that talks about some of the things that parents were concerned about when that issue came up. You think that'll work?
Oh, yeah, I got it right here.
All right.
2 children in separate age ranges. One is 8 and one is 13. So initially, our 8-year-old wasn't of age to get the vaccination. But once it became available for the group of, I believe it's 12 and up, Savannah, I just talked to my husband. We talked about it. He had some concerns. Initially, he was saying that, we wanted to wait a couple of weeks or whatnot. But I was able to convince him to allow her to be an early adopter and go ahead and get it. So we made an appointment And I took her down there and she received her vaccination. And then we went back for the second dose. So it was really, no issue. It was something that we were going to do once it became available for her age range.
So I have two sons, ages 15 and age 11. And I, like Shonda, was not 100% sold on the vaccination when it first came out. I had a lot of concerns about the side effects and the long-term effects. But after talking to my dad, I felt a lot more confident about moving forward with getting the vaccine, because I felt like the risk of not getting the vaccine, the risks of not doing that were far greater than actually getting the vaccine. So my oldest son got vaccinated as soon as he was able to. He's age 15. My younger son, who's age 11, is not old enough yet to get it, but I do believe when he is of age, he will get it, although I still do have some concerns with the fact that he's a lot smaller, he's younger, and I know that they're still doing a lot of studies around whether or not younger kids should actually get it, but more than likely, like I said, I will get it, but I am a little bit concerned and also hesitant. I know he won't be the first one to get it when it rolls out for his age group.
A lot of the concerns about the vaccine, especially if it relates to children, have had to do, Mr. Dean, with the hesitancy, with the myths around the vaccine. And we have a little summary of some of those myths in our next segment.
One is, if I get the vaccine, will it give me COVID-19? Another one is, does it cause infertility? And another one is, does the vaccine kill you? Can you die from getting the vaccine?
Dr. Carey, please.
Sure. So the first one is, does getting the vaccine give you COVID? And the answer simply is no. There is no virus that is within the vaccine. So the vaccine is preventing COVID. It does not give you any part of the coronavirus within the vaccine. The second one is it have issues with cause infertility. And I understand that as a mother. I have a teenage girl who, I definitely don't want her to have any issues with wanting to conceive when she's ready, which better not be now. But when she is ready, I definitely don't want her to have any issues with that. But there is actually no evidence that it has any issues with infertility. The way that the vaccine works does not interfere with the same pathways it works in terms of the process of being able to have a baby. So that's number two, as well as the American College of Obstetrics and Gynecology and the American College of Neonatal Medicine all agree that you should vaccinate pregnant women. And then finally, do people die from vaccines, from this particular vaccine? And I would say very similar to what Dr. Brooks said about side effects. You can never say never, and you can never say no 100%, because everyone will react differently. But the majority of people have tolerated this vaccine without any major issues. And if you look at the number of people, first of all, there's never been any vaccine associated deaths that they can link directly to the vaccine. But there are people who may have had a significant reaction to the vaccine, and that may have contributed to their death, along with maybe having other medical issues. But just as there are car accidents and we still drive our cars, where people go to amusement parks and have these fluke accidents on roller coasters, yet we still ride our roller coasters, there should be the risks of a serious side effect from this vaccine is so low that you would want to take the risk of taking the vaccine versus the risk of getting the virus itself and having it cause long-term damage in your body.
Yeah, so let's go back, Mr. Dean, and let's go to where we are right now.
Right.
The hesitancy issue is still with us. Nobody has a clear solution. We just figured that we love people enough. We're just going to keep talking about it and keep giving information. First of all, what are the recommendations now for who should get vaccinated?
Everyone,
I
up
mean,
down
what?
to age 5, right?
Everyone down to age
Down to
5.
the age of
Right.
5. So children 5 to 11 are able to get vaccinated. They get a different dosage amount, just to let people know. Then you have your teenagers 12 to 18, and then of course, and everybody from age 5 on up.
All right. Well, one of the things that people are hesitant, I mean, you don't consider a lot of the time when you're making that decision is the impact of children being able to go to school.
Mhm.
And the fact that this distance learning didn't work so well, and that just being in school may require vaccination rates in schools. In districts in this area, they're pretty tough. I mean, you got to be vaccinated. When you go back to school in January, you have to be tested. And so consequently, I think the schools playing a big part in the whole issue of vaccinating children. The other piece of that is, what about the booster?
I would recommend if you're vaccinated, get boosted, right? Because some of the preliminary results, particularly around the Omicron variant, is that the booster has been shown to be more effective in terms of protecting you from the catching it, right? And so we really, there's different lines. And so I want to just make a statement, to eliminate some of the confusion. The vaccines were never created to prevent you from being infected. That's not what a vaccine does. This vaccine was created to prevent you, if you did get infected, to prevent you from having the severe reactions, and that is hospitalization and death. And to this point, the vaccines are doing an excellent job of preventing people from having severe reactions to COVID and having dying. There have been some breakthrough cases, and there have been some people, but it's been less than 1% of those people that were vaccinated that died. And then when they studied those people, they had, like Colin Powell is a prime example. He had multiple myeloma, which is a cancer of the bone marrow, and that impacts your ability to produce antibodies. And so he was immunocompromised, and so therefore when he caught COVID, that's why he died. So they can explain most of the people as to why they died. And so when you're talking about less than 1%, and so what I heard in those pieces was people want 100% certainty. There's not 100% certainty in anything that you do. And I love the example of the driving, right? Every time you get in your car, there's a chance that you may not make it back home. But you still get in the car and go places. You still travel. You still do what you need to do. It's the same thing with the vaccine. If you want 100% certainty, it's not 100% certainty in anything in life. So to expect that from a vaccine is really a little bit out of, it's an unrealistic expectation. The second thing I would say is that when we're talking about the ultimate, vaccine, where we are is, we've got to put it all in perspective, right? And when people complain about distance learning, oh, they were home virtually, but then they want them to go back to school, but they don't want them to wear masks when they're in school, and then they don't want them to get vaccinated. But you're sending kids back to school on what? Hope that they don't get sick, and kids are showing to be hospitalized. Kids are showing themselves to be dying as a result, not at a high rate, but they're still having those experiences. And so so that's where my confusion comes in. It's like, I don't understand what the population wants. And so that's where the CDC has to kind of take some hard lines. That's why you see the government taking some hard lines, having some vaccine mandates, having some mask mandates, because people keep shifting what they want, and we can't please everybody all the time.
Yeah, the interesting study this morning from South Africa, that the reason the Omicron virus is not as deadly is because we have some natural immunities that protect us against viruses, and the whole system called T cells, which is different from antibodies.
Right.
And so consequently, these things are just keeping you're not from getting infected, but from getting deathly ill. Finally, in this piece of the discussion, clear up for us, please, what we're supposed to do. You know what I mean? We had a little thing in our family where we thought somebody might be infected. We didn't know to quarantine 5 days, 10 days. And one of my patients called me. She wanted an excuse for a month from work because she'd been quarantined for a month. Now, what are these new guidelines all about? It is a bit confusing, isn't it?
Okay. So, all right. So if you're, here's where I would say, right? And I mean, I read the guidelines, but I'm going to say, I'm going to give you the Ellis Dean version of what you should be doing. What you should be doing is this. If you have a potential exposure, I would say quarantine yourself from your family, friend, whatever, quarantine yourself for at least 3 days. Get tested at the end of that quarantine period, and then test again after 3 more days. Because we know at the beginning of the pandemic, it was taking up to 14 days for you to show up positive. And so now the Omicron has been showing up faster, which is a good thing. Typically, if you have symptoms, and there's a list of symptoms on the CDC website, if you have symptoms, you should be quarantined. The entire time you have symptoms, you should be quarantined. If you're asymptomatic, you should.
Let me stop you a minute. But if your symptom, this is if you've been exposed to somebody, right?
Right.
Because if you're not symptomatic, then you can just have a regular cold.
You could.
And so if there's any question, you should probably get tested, right?
Yes, and if there's any questions, get tested. It doesn't hurt you to get tested. It's a little bit uncomfortable. It's about 10 to 15 seconds, especially if you get that PCR test. I've had it multiple times. It's not pleasant. It feels like they're stabbing your brain, but it gives you peace of mind, and that's the most reliable test. There are some tests, the home test, but if you're doing it at home, please don't short that test, because I've done some home tests as well, just to make sure, if I had any potential exposure to COVID, because it's really about, and it's not about me, because I'm relatively healthy. I know, I believe if I caught it, I would survive it, but it's not about me. It's about somebody I may infect, unknowingly, and they may not survive. And so I've had family members that have passed away. They were young, they were in their early 20s, and so I know how serious this particular virus can be.
I think that it's important for us to say that we recognize that a lot of you who are looking and listening to us are very, very passionate about not getting the vaccine. But I want you to understand that I'm very passionate about you getting the vaccine. And so I'm not going to necessarily criticize you about your passion, but I don't want to be criticized for mine. I'm a pediatrician, and the pediatricians involve themselves in the lives of these children. And we love these children. I mean, they become our children. And I would not recommend for my patients, a vaccine that I thought was dangerous in any way. We give 15 vaccines that you've already had. People don't realize that measles used to kill 1 out of every 1,000 people that had it. Chickenpox, 1 out of every 2,000. Right. And because of vaccines, my office is virtually empty most of the time, when we used to see up to 100 patients a day. And so consequently, my passion for you getting a vaccine is built in my belief that these vaccines are safe and effective. I respect your position. I hope you can understand and respect mine. All right, we're going to take a quick break. We'll hear another message about the vaccine. Then we're going to talk about racism and health.
Roy Lindo, and I had the coronavirus. So I know from personal experience how devastating a coronavirus infection can be. Now, fortunately, I fully recovered, but I don't want anyone to experience what I went through. We're living in very dangerous times. On many levels, our communities are under siege, under attack. You know it, and I know it. Now, in the face of that, we need to help and support each other wherever and whenever we can. One of the ways we do that is to get vaccinated against the coronavirus. That protects you, your friends, and your loved ones. With everything we're facing in today's environment, please get vaccinated. Ensure that our communities remain strong, healthy, and well. Thank you. I understand.
Yeah, so that's another message. Now let's move into our discussion of the other big topic of the year, and that's the impact of racism on health. I mean, it just amazes me that this seems to be a health, what we call health equity issue, because as a Black doctor, I've known about this ever since I started practicing, that the Black community is less healthy than any other community for a number of reasons that beyond their control. Much of it is what we call the social dynamics of health. But the other issues have to do with some of the things that we do in terms of lifestyle. And now all of a sudden, everybody wants to talk about health equity, health equity, health equity. I think a lot of the issues around health equity have to do with how the health system, not just on the things that we have, chronic diseases like renal disease or pulmonary disease, asthma, cancer, and these kinds of issues, but it has to do with how we're treated when we enter the system. One of the big stories of this for us here on BlackDoctor.org and the African American Wellness Project was the situation with Dr. Moore. I think it was Dr. Moore,
More, yeah.
who was in the unit for COVID, who ultimately succumbed to the disease. And I will just let you listen to her situation because it highlights many of the things that we need to talk about, as they say in the big news place on the other side.
At that time, I'd only received 2 treatments of the remdesivir. Because you don't need it. You're not even short of breath. I said, yes, I am. Then he went on to say, you don't qualify. Most of it because I've gotten 2 treatments. Then he further stated, you should just go home right now. And I don't feel comfortable giving you any more narcotics. I was in so much pain from my neck. My neck hurt so bad. I was crushed. You made me feel like I was a drug addict. And you know I was a physician. I don't take narcotics. I was hurting. So, spoke to patient advocate who left me wanting. There's not much I can do. So I started asking, send me to another hospital where they can treat me. And if they're not going to treat me here properly, send me to another hospital. Well, next thing I know, I'm getting a stat CT of my neck with and without contrast. The CT went down a little bit into my lungs, and you could see new pulmonary infiltrates, new lymphadenopathy all throughout my neck. And all of a sudden, you have to treat your pain. You have to show proof that you have something wrong with you in order for you to get the medicine. I put forward and I maintain if I was white, I wouldn't have to go through that. And that man never came back and apologized. This Dr. Bannock guy. And then today now, so let's be getting narcotics, right? They came in 9 o'clock. I've been in pain since 7. And when they came in, very, very sympathetic. Yeah, we will get you pain medicine. I don't want to give you IV narcotics. How about PO? Fine. I just want my pain to end. So then, he says, well, what pain medicine? I said, I don't know. I don't take them on a regular basis. I don't even write for them. All I know is that I'm in intense pain, and morphine worked. Okay, well, we'll give you Percocet. Okay? I don't know nothing about it. I don't think I've ever had it. It was another 2.5 hours before I got the pain medicine. And the nurse came in, but the first thing I said to the nurse was, why did I have to wait for so long? The nurse snapped back, Well, you're not my only patient. I have 5 other patients, you know. I said, I have been in pain since 7 a.m., you know. Well, I can't be in here every 5 minutes. I said, no, you were in here once in 4 hours. What? I was in here an hour and a half to 2 hours ago. That was once, since your shift started at 7. Well, I had other people, and I had to take the shift change. We had to give a report. I'm a patient. Are you going to take care of me or not? And he went in. Now, that is not how you treat patients. Period. So I don't trust this hospital, and I'm asking to be transferred. These people wanted to send me home with new pulmonary infiltrates and all kind of lymphadenopathy in my neck. The other thing that white Dr. Bannock said was that if I stayed, that he would send me home Saturday at 10 p.m. in the dark. Who does that? On a week, who does that? And that nurse was telling me, oh, I was marching in Black Lives Matter. I told him, no, I don't believe none of that. Not one bit. Not one iota. He wouldn't even know how to march. I can't even spell it. This is how black people get killed. When you send them home and they don't know how to fight for themselves. I had to talk to somebody, maybe the media, somebody, to let people know how I'm being treated up in this place. And he gladly told me, I know you're a doctor. But he didn't want the black doctor to have no medicine, nothing. And then had the nerve to say it's because of him, the nurse, that I got the medicine. Really? Because of you? No. How about because I had that stat CT in my neck, where it showed all of that lymphadenopathy and infiltrates? Yeah, you didn't know about that? You didn't get that in report? That's what I said. To being black up in here, this is what happens.
Yeah, so that's such a powerful piece. Says so many things that we need to understand about the healthcare system and how it treats and disrespects African Americans. I think that is one of the big stories, is that the impact of racism on almost any chronic disease seems to be fairly significant, and most African Americans just bear it. But it's also an issue of when we enter the hospital, exactly what happens. This is just a classic example of what I've seen as a doctor through the years about how Black patients are treated very, very differently. And you need to remember this video, because this could be you. It may not be for a life-threatening issue. It could simply be for something else. Right now, we're staring down the whole issue of Black maternal mortality. That means African American women are dying, delivering babies in much greater rates than other ethnic groups. And so consequently, it brings up the whole issue, doesn't it, Mr. Dean, about the whole, what we call unconscious bias and discrimination within the system, something called healthcare disparities.
Yeah, definitely. Unconscious bias plays a huge role, and we have to recognize where our biases are. And so I think and there is a misnomer. That's another big word there. There's a misconception that doctors don't have bias, right? And so, but when you just do a quick Google search, right? You don't have to do a whole lot, you can do a quick Google search and talk about biases in healthcare. There are biases that are still being taught to this day about Black women, Black people in general, having a higher pain tolerance. Black people in general having thicker skin. And so there's all these unconscious biases. And so we bring that to the job with us. And so they're not recognizing that the impact of the biases that they are practicing with has a negative result with regards to our adherence, our follow-up, all of those things. And they want to blame Black people for low adherence and low follow-up. And they're not taking responsibility for how they're treating Black patients when they come to present. The other side of that is this. There is a narrative that we have in our community that we've got to get over. There are some wonderful Black practitioners. We have to take, and you talk about it all the time on every show that we do. Health is your biggest asset. So you have to protect it. And we have to be better advocates for ourselves and demand better service. And it doesn't mean we're always going to get it. But if we don't know what our blood pressure numbers is, we don't know what our blood sugar numbers is, if we have diabetes, if we don't know what our PSA level is, if we have a family history of prostate cancer, if you don't know you have a family history of prostate cancer, we have to be more proactive with regards to taking charge of our health, because as evidenced by Dr. Moore and other anecdotal stories, that if we leave it in the hands of somebody else, it could be a death sentence.
I think there's no question about that. You have to be extremely prepared. And I think there's a lot in the system that works against you once you go in there. I think we in the absence of more time, we do have at least an understanding of the fact that you need to, know what you have, know what questions to ask when you go in there. And you need to have, when you go in the hospital, you need to have an advocate. That means somebody who can talk to these doctors when you're not feeling well or not available, not observant. It just can't naturally be your brother or your sister or your parents. It has to be someone with some health knowledge to know, as they look at things dripping in your arm or bells going off, or the fact that you're not getting attention, that they can respond in a way that will make the system much more sensitive. We'll be dealing with that through the year with Dr. Glenda Newell, who's the author of a book called Your Better Health, a book that each one of you should have, and that we probably will start giving away with the next show. But I want you to remember this video, because this could be you. It may not be you in such a severe situation, but it could be you even just going into the doctor's office, being disrespected, not having your questions answered, nobody responding to the issues that you're concerned about. And there are techniques and things that you need to be considering when you enter the healthcare system to get the best possible care. I always say this, and I've said this many times. Two things: if I'm in a strange city and I have an immediate problem, I'm going to try to put a tie on and some briefcase and before I go to the emergency room, because otherwise, and I'm still not going to get the same level of care. The other thing I would say is, if we got mad at healthcare that is poor in quality and disrespectful as we do when somebody cuts in front of us in the Safeway line, we wouldn't have this problem. I mean, I hate to say it this way, but sometimes you just have to act black when you go into the healthcare system to get the respect that you need and a proper treatment. And believe me, racism and this kind of health inequity does affect outcomes.
Well, I want to give a quick shout out to Marcy Davis. She's been on with us before. Remember we did our nursing show a few months ago? Marcy Davis Fitzgerald is watching us today, and she is a wonderful nurse practitioner. And I want to give her a shout out for representing for Black people in healthcare professions. So shout out to Marcy for that. Also, I will say you're absolutely right. I think when we say act Black, and we all know what that means, we have to be careful, and because when we do that, then that leads to more stereotypes and biases, right? It can. So I do think that the best route is, as you talked about, being having an advocate that can speak for you if you can't speak for yourself, and come to BDO, right? That's why BDO exists. And that's why we have such a large audience, is because people come here, they get the information that they need, and then they can go and speak that language when they go to the cell. The second thing I will say is this: we've got to stop using the emergency room as our primary care, right? And get your primary care physician and go see your doctor on a regular basis. Establish a relationship with your doctor, Black or otherwise. Establish a relationship with your doctor and give them the stuff that they need to let them know, hey, I am concerned and I am active in my own healthcare process. I think those things will be a better way to get the services that you need versus acting like, now, if they act a fool, I will always reserve the right to cut up on you. But I'm not.
I knew it took us 2 or 3 shows before we started to disagree a little bit. I thought it would be sooner than that. Look, I've been a doctor for almost 40 years, now almost 50 years, really, between 40 and 50 somewhere. And let me tell you something. One of the weapons that we have to fight against healthcare disparities is attitude. If you go into an office and they don't treat you with respect, deal with it then. Don't wait to see if it's going to perpetuate itself. And let's play the little piece from Dr. Hood, so people can kind of get a sense. Do we have time to do that?
Yeah.
So that's the second video.
I got it.
All right.
As a little boy, my mother, I grew up in Roxbury, which is the poor area of Boston. My mother was taking me to City Hospital to a usual clinic. The clinic is full of patients, white, mostly white, Black. There was a young white resident was calling patients, Miss McDonald, Miss McDougal, Miss Castellano. And all of a sudden, I heard my mother's name called, Evelyn. And I'm young. I jump up. Oh, hell, I'm tired of waiting. I heard him call her name, and she grabbed my arm and made me sit down. And I'm about 9 or 10, and I'm looking. He's calling you. So he's looking at her, and finally he walks over and says, Evelyn, it's your turn. And my mother looked at him and said, I did not give you permission to call me by my first name. It's Mrs. Hood. Grabbed me by the hand. We walked into the room. She never said another word to me. Now, I am very embarrassed because now the whole office is looking at us, and I'm more angry at my mother than anything else for embarrassing me like that. But that stuck with me, and that was total disrespect. So we're going back 50 years in the health system. We have been disrespected in the health system to the point when I opened up my own practice, I insisted that all of my staff address patients by their last name until they gave you permission to call you by your first name.
Yeah, I have never addressed a patient by their first name. I mean, I've never done it, unless it was just a kind of close friend of mine. But I think that point is well taken. We don't need to prolong it. But before we end, I'd like to play maybe one more piece, one more reminder. Again, we hit that last piece. This is only about a 30-second piece, and then we'll kind of wrap this up.
I'm Dr. Donna White Carey. Holidays are a great time for gathering, and giving gifts is our tradition. But we are still in the midst of the COVID-19 pandemic and dealing with multiple variants. But we have safe and effective vaccines. So if you are not vaccinated, how about giving the gift to your family and friends that you finally got that COVID-19 shot? This message is sponsored by the African American Wellness Project and Alameda Alliance for Health.
Just one more reminder: repetition. We're gonna be doing that all week.
Listen, rinse and repeat.
And I think that's all we have for this week, Mr. Dean. I think we'll be back next week. We'll be talking about those issues that come up during the week on healthcare things that you need to be aware of, that we think you need to be aware of. We'll present them in the best way that we can, and we appreciate your investment in listening to us. And if you have suggestions about topics and things that we need to be taking on, on a more regular basis, please let us know. And as you said before, health is your biggest asset, so protect it.
Happy New Year, everybody.